amazing Alessia and Devin will be co-hosting, so I will let you two kick it off.
Hi, everyone. So thank you so much for joining us in our second day of our Feminist Health Conference. Today, we are kicking in with our storytelling for Stigma-Free Futures event. I am Alessia. I am the Director of Events at Medical Herstory, and today I will co-host with Devin.
Hi, everyone. I'm Devin. My pronouns are she, her, and I'm a volunteer with the events team here.
So if you were not around before, Medical Herstory is an award-winning youth-led international not-for-profit organization advancing and advocating for gender health equity throughout storytelling, patient advocacy, medical education, and undoing stigma. And we hold events, workshops, publish stories, and our goal is to eliminate sexism, shame, and stigma from health experiences. This event wants to probe into what a future without stigma may look like. And stigma often underlies health experiences, and overcoming it can be very challenging. However, through storytelling, we can learn how others have worked to fight stigma and empower themselves. We hope that this event can inspire all of us to reimagine a future free from health stigma and shame.
Before we get started, we'll go through our typical Zoom rules as you've heard before. Please remain muted unless you are asking a question in person. We encourage everyone to keep their cameras on and, of course, use the chat if you have any questions at all. We do also have active listeners, and they should have that by their name in case anyone feels like they want someone to talk to throughout the event. Of course, we always prioritize respect towards everyone here. If you'd like, closed captions are available at the bottom of your screen. We also want to have a content warning just in case you need to reach out to an active listener or anything. But today's topic can touch on some very serious things such as sexism, racism, ableism, medical trauma, mental health, and other sensitive subjects. So we are grateful for all of our speakers today, and we hope that you all practice self-care, and always feel free to reach out for us if you need extra support. Very happy to have you here today.
So we now are going to present our speakers. So I'm gonna welcome Tihesia and Gaylyn. Gaylyn is a biology and public health graduate. She has founded the nonprofit Godless and Glamorous to empower those living with or contemplating ostomy surgery and erase the negative stigmas and misconceptions surrounding ostomies. Gaylyn has suffered because of the stigma.
Sorry, Alessia, you're muted.
I don't know why. So I was saying Gaylyn has suffered because of the stigma associated with living with an ostomy and does not want others to face similar challenges. She actively seeks out opportunities to increase ostomy awareness. I will leave the floor to Gaylyn.
Good afternoon, and thanks, Alicia. I'm so happy to be here. I want to apologize up front. My voice is a little hoarse, so bear with me. But yeah, like Alicia said, I just going to tell you a little bit about me. So I was diagnosed with Crohn's. Crohn's disease, a severe case of Crohn's colitis, which means that I had Crohn's disease in my colon, which is the large intestine. And I suffered for, a very long time, from 14 for almost over a decade, because of my diagnosis and because of the stigma. So, living with a chronic illness, there of course comes stigma with that. But on top of that, and especially with Crohn's disease, if you're not familiar, is an inflammatory bowel disease, or is classified as an inflammatory bowel disease along with ulcerative colitis. And, because of the nature of those those diseases, which involves going to the bathroom, several times a day. It could be diarrhea because of those types of symptoms. Crohn's disease is very often, and IBD is very often stigmatized. So, at the age of 14, when I was just entering high school, I was diagnosed. So it was a big change for me. My body started to change, different things started happening. And I learned that I have to control how I respond to, my body changing. It was a process, of course, but as I mentioned, I suffered for a very long time due to the stigma of Crohn's disease with IBD. And then because of where my disease was, my medical care team told me very early on that I would have to have my colon removed, which meant that I would have to live with an ostomy. And for those that may or may not know what an ostomy is a medical procedure, a medical procedure that brings your intestines on the outside of your abdomen. And then you wear an appliance over that to allow waste to enter or to exit your body, because you no longer have, they take out the lower part of your colon, which is your rectum. And so that's the type of procedure that I knew I would eventually have to have, and suffered for a very long time because of the stigma of having an ostomy. It wasn't only what I heard throughout the media of ostomy or a colostomy bag. I'm sure many of you have heard of a colostomy bag. In the media, it's often negatively stereotyped. There are, you may hear in different shows, medical shows, that a patient has to have an ostomy, and it's oftentimes very stigmatized. So I suffered, like I said, for a long time due to the stigma of having to have an ostomy. Even my medical care team, they were opposed to me having to get an ostomy as well. Not my surgeon. So as a patient with Crohn's, and that is having to have surgery, you have a medical care team that includes, your specialist doctors, gastroenterologists, as well as the surgeon. And so my medical care team, the gastroenterologists, were, hesitant about me having to have an ostomy. They knew that I was terribly ill. My colon was slowly killing me due to the disease. And despite this surgery that could, potentially help tremendously, even my medical care team was hesitant because of the stigma. And because of the severity of my condition, I was constantly losing a lot of blood. I was losing a lot of weight. I was terribly sick. I was dying, and I had no choice but to have ostomy surgery. After I had ostomy surgery, I realized I felt so much better very quickly. And, I realized that something has to be done about the stigma of having an ostomy, because my quality of life improved drastically almost immediately. And that's why I started my advocacy, and that's why I started my organization, because I didn't want others to suffer, unnecessarily because of the stigma associated with having an ostomy. And that's what, I do now. As Alicia said, I actively seek out opportunities that I can showcase and show the world, that ostomy surgery isn't a death sentence. And, through my advocacy, I've been able to have bigger platforms that I'm able to, show how ostomy surgery isn't a death sentence. Somebody actually reached out to me and told me that they, prior to seeing my photo online, that when they realized they had to have ostomy surgery, that they actually contemplated suicide. So erasing the negative stigma not only improves quality of life, it actually saves lives. So, you know, that's what my advocacy about, and that's what I strongly believe and want to put out into the world.
Thank you so much for sharing your story with us, Gaylyn. I will pass it on to Devon.
It is my pleasure to now introduce Tihesia. Tihesia uses she, her pronouns and is a 24-year-old junior doctor in the UK. In 2020, she completed a research degree in pregnancy and reproductive health. And during this time, she was diagnosed with endometriosis. This inspired her to create She Talks, a sexual and reproductive health awareness initiative to highlight health inequities and improve health education. We now welcome Tihesia to share her story.
Thank you so much for having me here today. I'm really honored to be invited to talk. So yeah, I'll be talking a bit about my experience. I'm quite privileged to have an experience of stigma and health inequalities from both a patient and a medical professional perspective. So second year of my studies, I started to experience really severe period pains, chronic pelvic pain, back pain, pain with passing urine and going to the toilet and that sort of thing. And I put up with it for a really long time because in medicine, there's quite a culture of being resilient and not really taking time for yourself. It's not really looked upon positively all the time to take time out to look after yourself in medicine. But I got to the point where I couldn't take it anymore. I was sort of killed over in lectures with period pain. I was trying to study in the evenings, sort of in bed, having to take painkillers that would make me feel drowsy, and still having to sort of prepare for exams and things like that. So I thought, this is enough. I contacted my university and said, just in an email, that I'm going through XYZ. I might need to take some time off lectures or placement to, you know, attend GP appointments and things like that. I was met with quite a serious email that said, okay, we've scheduled you in for an appointment with our occupational health doctor who will evaluate whether you're suitable to continue with your studies, which was not what I was expecting at all. So that already sort of had me anxious, and I was prepared to sort of say whatever I had to say to not have to interrupt my studies. So I attended this appointment, and the doctor was actually really, really nice. But he sort of nonchalantly said, yeah, this does sound like endometriosis, but you're not going to get diagnosed anytime soon. And I sort of thought, like, you know, you go to a doctor, you tell them what's wrong, and then they refer you to who you need to be referred to. But that wasn't the case. And I think I sort of went into it thinking, you know, I'm a medical student, like I know how to present a history and summarize symptoms and things like that. But every appointment that I went to, I was so anxious and still had to write everything down and still forgot things. So yeah, I had 3 years of GP appointments, clinic appointments, wait times, rejected referrals, which 3 years, it felt like hell at the time. But I know that for some people it takes up to 10 years to be diagnosed. So I feel really lucky that for me it was a relatively short time in the grand scheme of endometriosis diagnoses. So 3 years later, I had my surgery, came out of the surgery, and the nurse said to me, they found endometriosis, they've removed it. And I was shocked, relieved. I felt like I'd finally had everything confirmed, and you know, I wasn't making my symptoms up. All the people that didn't listen to me were wrong. And then my surgeon came to visit me and said, we found a few spots of endometriosis, but that can't be causing your symptoms. Like, there's no way that this endometriosis could cause that, because there's not enough there, and you should be grateful that you don't have endometriosis, he said to me. But on my report, it said that I had endometriosis and my symptoms resolved after the surgery. So I have endometriosis. But it's a well-known fact that the amount of endometriosis that you have doesn't actually correlate with the symptoms. So people can have a lot of endometriosis and not have many symptoms, or have a little bit of endometriosis and have really severe pain and discomfort. So from that experience, I feel like I was able to reflect a bit on what might have contributed to me not being heard and not being listened to. And I've sort of broke it down into 3 factors. So I thought about the fact that I was presenting as a woman, and it's a well-known fact that women will attend healthcare and not be listened to. I think hysteria was a diagnosis for women presenting up until the 1950s in America. And especially with period pains, when women attend the doctors, they're told that periods are supposed to be painful and you're to suck it up and deal with it. The second factor is that I was presenting as a Black person, and it's well known in research that medical professionals demonstrate racial bias when perceiving pain in Black patients compared to their white counterparts. So they perceive Black pain as less authentic than white pain. And thirdly, probably less seriously, I was presenting as a medical student, and medical student disease is a well-known thing. You learn something, you think that you have it. So it could have been any of these symptoms, any of these factors, or none of them. I will never know. But out of that has come a great inspiration and a passion for tackling stigma and health inequalities. And I believe that this is on sort of 3 levels. So I think about helping the doctors of tomorrow to learn in better ways. So adapting medical school curriculum to be more equal, diverse and inclusive. Secondly is sort of patient advocacy and awareness and empowerment. And I do this through my project She Talks, where I sort of make infographics and videos about different sexual and reproductive health conditions, and interview different people with chronic conditions in order for them to share their stories and empower other people. And finally, as a healthcare professional, I think it's really important to get involved with quality improvement projects and improving patient safety, and really analyze the services that you're giving in order to improve them, and actually listen to patients. Even on a more sort of smaller day-to-day basis, just being kind and being empathetic and listening. And I try to do that in my practice and afford people with the consideration and the listening that I didn't feel that I had as a patient. That's just a bit about me and my story. Thank you for listening.
Tihesia, I'm wonderfully moved by how you have managed in a career that can be very high pressure, to focus on yourself and recognize that degree of empathy that you deserve as both the medical student and the patient. I think it's really inspiring, and a lot of people in medicine need to continue to think that way. So with that, we thank you for sharing your story, and we will now move into the question and answer portion. So our first question that either of you could answer is, how do you feel stigma has affected your experience in healthcare?
I can go. Oh, she's just unmute. Do you want to go ahead, Gaylyn?
It doesn't matter. So I can go ahead. So how has stigma affected my health experience? You know, I shared about my journey with Crohn's disease and my hesitancy to receive ostomy surgery solely because of the stigma. I feel that I don't know, it's tough. I hate to say that I regret, or the only thing that I do regret is that I did not do it sooner, that I did not have ostomy surgery sooner. I had ostomy surgery when I was 21, you know, still very young, still at a time that, you know, life is changing for you, but yet you're now dealing with the new changes to your body and how that impacts you and your life. You know, the stigma of having ostomy surgery back then and still to this day definitely impacts me, you know, and that's why I strive so hard to break that stigma, because I see how it impacts. I know the feeling. I know what I needed to see when I was younger, right? And people reach out to me all the time and how they're struggling because of the stigma, struggling to have self-acceptance. In the media, negative or ostomy surgery is seen so negatively that it can drastically impact how a person sees themselves or how they view themselves. So really just stigma does impact those living with chronic illness, not even ostomy surgery, just living with chronic illness, having a sense of loss of control of your body. It impacts you greatly. As a Black woman, as a disabled Black woman, it has definitely negatively impacted my life. And that's why I work so hard to, be who I needed when I was younger. So.
Yeah, I agree. I think for me, I think things like periods and sexual health and reproductive health and gynae health, it's not really spoken about in general, but also I think in ethnic minority communities, it's a bit hush. So I think I feel quite lucky in the fact that my family has mostly been quite vocal. Like my mum's always sort of talks about periods openly and things like that, but I know for a lot of people that's not the case. So I think the process in terms of going from having a symptom to then talking to a doctor is a long process in terms of, first of all, recognizing that something's wrong. Second of all, comparing yourself to other people. If you don't know norms because you don't talk about things, you don't know that you're experiencing something that's not normal, because it's not talked about. And then actually attending healthcare, that can be stigmatizing in terms of what field you work in. For example, me with medicine, like I didn't feel like that was a done thing. Taking time out for myself wasn't a done thing. So I think stigma can affect chronic conditions in terms of just being comfortable in talking about things. Things aren't talked about enough, and that leads to people not seeking help for them and not getting the care that they need, and then having poorer outcomes.
I think both of you made wonderful points, Gaylyn. I think that it's very inspiring to be what you wanted to see as a child. I think that it's definitely a huge source of inspiration for a lot of us here today. And Tihesia, I think you're exactly right that these conversations are totally complete if intersectionality isn't addressed. So I think you both make wonderful points. Alessia will ask the next question.
Yeah, so the next question maybe was covered a little bit before when you presented your story, but we just wanted to ask, how do you defy stigma? What did you do in your own experience to go beyond stigma and maybe reclaim your power back? Gaylyn, do you want to start?
Okay, absolutely. And I love that, reclaiming your power, changing the narrative of what you know. For me, starting my nonprofit organization, Gutless and Glamorous, with the sole focus of empowering those living with or contemplating ostomy surgery. And, I do that through education programs as well as support programs. But public facing, I try to do fun things to dispel, ostomy stigmas, and just show myself living, despite what others may say. I try to do fun things for awareness, like create dance videos, with my ostomy out, just to kind of, help dispel the myths, dispel the rumors, dispel the stigma for the general public, as well as for those that may be contemplating ostomy surgery. And one of my I think one of my proudest moments is I am also a model for Aerie for American Eagle. And, you know, being able to do that has been nothing short of amazing. And the messages I receive, you know, are so empowering and so inspiring. And, you know, that's just a little bit of things that I'm trying to do to dispel the stigma. But, you know, there's still a lot of work to be done. But I'm up for the challenge and I'm excited moving forward.
I completely agree. Just sort of talking about it and
Right.
not stopping talking about it is the way to do it. I definitely believe in that. I feel like I'm one of those people that doesn't stop talking about it sometimes. But I think that's needed. And like, as I touched on, I think I try to do that with She Talks. It's not always just endometriosis focused. I try to cover sort of a range of sexual and reproductive conditions. And I try to get people engaged and sharing their own stories. So I've had, I think one of the most sort of personal things that I had shared with me was one of my followers' experiences of quite a traumatic birth. And just having someone share something really personal and something really traumatic that happened to them in order to inform and empower other people is so important. And I feel like that's really a part of breaking down the stigma. I think it also mentioned a bit about sort of medical education. So I think things will only go so far if patients can be empowered, but doctors aren't listening. So I think it's so important that the next generation of doctors are taught a more equal, diverse and inclusive curriculum. So at my medical school, it was a bit of a battle, but sort of getting things in, for example, about trans health and trans cervical smear testing and Black maternal morbidity and things like that. And just things as simple as having a range of abilities and races and genders used for things other than their stereotypical conditions. Like, for example, a famous case in my medical school was that a Black person was never used unless it was sickle cell or HIV, which is obviously like, why can people not be in for different conditions that have nothing to do with their race or gender or ability? So just, I think that's really important for breaking down stigma and getting it on both sides so that the patient feels comfortable to speak, but also can be rest assured that they'll be heard.
Thank you both for answering and to showing us how you reclaimed your power. I just wanted, before passing on to Devon, to remind you all that if you have any questions for our speakers, just please drop them in our chat. Devon.
Yes, so the next question I would like to ask is kind of getting into more of why do you think it's important to fight stigma? We see that that's a very amazing part of your journey and how you do it, but how do you, for example, how would you convey that to someone who doesn't understand or doesn't recognize the stigma? How would you explain to them why or what stigmas exist, how they can recognize it in their life, and why it's important for them to find it?
I'm going to start. I think for myself and for, you know, the stigma that I'm fighting so hard against, you know, it's colostomy bags, ostomy bags, you know, there's not much that I have to say other, you know, people recognize that and they kind of associate that with, you know, ill, gross. So, you know, for me, I think it's important because I've struggled with self-acceptance due to my illness and the devastating physical and psychological effects that it can cause, right? And like I said a little bit earlier, I've had young women, young men reach out to me and say, I really contemplated suicide if I would have to have ostomy surgery. And I can't say this enough, in the media, in, popular culture, having an ostomy is seen as so negatively that it can drastically alter one's sense of self-acceptance, one's sense of self-worth. It can cause them not to even get ostomy surgery, which ostomy surgery is life-saving. Like, it's just something that has to be done to improve your life, to literally save your life. And it's just so important to break that stigma, both in the general public as well as, medical providers or clinical providers, because for me, for instance, I recently had a physical therapy appointment. I have a vascular necrosis in my knees, or in my hips, sorry. And so I was going to start physical therapy, but aquatic physical therapy. And I went, and the physical therapist just flat out said, like, I don't think you can get in the pool because of your ostomy. And they're like, I don't think you can get in the pool. And, of course, her saying that, it was just me and her in the room. I was devastated to hear that, personally, I was very upset. I started crying. And I think that's why it is so important to break whatever medical stigmas that are out there, because that's false. And education is key. As she said, that educating people about the condition, about the facts and not the myths about having, certain medical conditions are key in moving forward and how we treat and how we treat patients. So. Mhm.
Yeah, I think that in terms of like explaining it to someone who wouldn't understand what stigma is, because I think it's true, like a lot of people don't understand why people go on about these things, or have so much to say to them. But I think it's like asking someone to think, like, imagine having this thing that was really bugging you, really stressing you out, and nobody will listen to you, and anyone that does hear you thinks it's gross, or thinks that it's not that bad, or thinks that it's just a woman thing because it's periods. I think that would be something that would like sort of get people's attention. And I think sort of from my field and what I aim to break stigmas on, like periods are common, endometriosis is common. It's 1 in 10 for sort of diagnoses, and that's not counting all of the people that have symptoms and have not been diagnosed. And I think it's important to address, because these things, it's not like people have symptoms and they just get brushed under the carpet and it's fine. They just carry on with their lives. Like, no, people die, people's outcomes are poor. It's not a small thing. Like, stigma affects outcomes, it affects lives.
Thank you so much for sharing. I was thinking that seeing how you advocate for your condition, but you do it perfectly. But I think that also you speak a lot to, both of you speak a lot also to people that do not have the same condition as you, or maybe, as you were saying before, Tihesia, people that do not have a diagnosis yet. But we were wondering, in your experience with your condition, did stigma play a role in the diagnosis process or its aftermaths?
So I think for myself, as a Black woman, as a disabled Black woman, I'm dealing with several stigmas, For me, when I was diagnosed, I was diagnosed at a time where they didn't think that African Americans would get Crohn's. It was typically seen as a Jewish disease. And so I struggled initially with that, after being diagnosed. Like, fortunately, but unfortunately, I was diagnosed quickly because of the severity of my condition. But because I was, a Black patient with Crohn's disease, it was almost a medical mystery. And so my medical care team, was, well, she's Black. Why is this happening? Da, 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 da. And then for myself to then have to have, because of the severity, have to have ostomy surgery. It was challenging. It was difficult because, like I said, my physicians just didn't understand A, why I had it, and then B, because of the severity, why I would have to have ostomy surgery. So, I think it's critical to address stigmas in medical care, whether it be, as she mentioned, with Black people and how they experience pain, because that's a real thing that I've had several experiences myself, seeing multiple doctors because the one I go to doesn't believe me, just flat out doesn't believe me. So, I'm going, as a Black person living with a disability and living with chronic illnesses, multiple chronic illnesses, it's difficult and it's critical that we address and educate on different stigmas, on different myths that arise in medical care, whether it be due to race, whether it be due to illness. And I applaud you all for, holding this convening and, wanting to get the word out there, because that's what needs to be done. We just have to educate, in general, educate the general public, educate medical providers as well. And, I feel like that's the importance of breaking down stigmas.
Yeah, I completely empathize with that feeling of not being heard, not being listened to. And I think as I was going through the process, it's so disheartening because you don't want to believe that that's the reason that people are not listening to you, but you never know. And it's just such a process of like the willpower that you have to keep building every time you go to a new appointment, or every time you see a new person, or every time you're recapping your story, and you leave an appointment feeling like, oh my God, did I miss XYZ? Like, is that gonna affect the way that they see things or what they've documented? Like, it is such a mental game. And I think that as well, like, I don't know if we've touched on like through chronic disease and the diagnosis process, the effect that it has on your mood is absolutely ridiculous. Like, it's overthinking central and low mood central. Is a really difficult process. In terms of what I think affected me, I think probably race probably had something to do with it, as well as presenting as a female. But I think it is really hard to tell. And I think one thing that affected me, especially with the aftermath and dealing with things sort of between figuring out that I think this is endometriosis, now it's convincing everyone else, was things like my occupational doctor at the occupational health appointment said something like, oh, we can make enhancements to placement and things like that, because I found it really difficult to stand up for a long time. And being a medical student on placement, it's like 3-4 hour ward round, you stood up for the whole time. And they were like, oh, we could get you a chair for ward round. And I just knew that that was such an unrealistic suggestion. Like, so then I'm going to be the Black girl sat in the chair, and they're going to ask me why I'm sat in the chair, and I'm going to have to say my periods are really painful and I've got chronic pelvic pain. Like, as such a stigmatizing topic, saying that in a room full of people where as a medical student I already felt like I didn't fit in, like I have really bad imposter syndrome with being a doctor and being a medical student then. I think that was really difficult and contributed to the stigma. Sort of thinking about after the surgery, I really struggled to get to grips with the fact that that was my time to take time for myself and to recover and that it was okay that I was moving slow and that I couldn't do things. Like, this is when I was doing my master's degree. So I remember having an assignment that I had to submit the night before my surgery and one due 2 weeks after my surgery, and coming out of my surgery and answering emails, having had 2 doses of morphine and coming around from anesthesia, and then having a call with my program directors and then being like, don't do this assignment, like just relax. Like, I overworked myself so much that my stitches came open and got infected. Like, I think the stigma of just having to carry on even though you've, you know, had like a life-changing event happen, can really get to you with chronic disease, and just reminding yourself that it's okay to slow down and to take time and to look after yourself. And I think that's what underpins all chronic conditions.
Thank you so much for sharing. I mean, on a personal note, it was really painful to relate to some of the things you said. But moving on, I would pass you to Devin.
Listening to both of your stories, I can't help but think about how lonely and exhausting all of that feels when these conditions, in addition to all of the life stressors, not just as women, but as Black women, and also dealing with these conditions that are shrouded in a lot of either stigma or are under researched or invalidated. I'm wondering, for all the people out there who are also struggling with stigma, not diagnosed, afraid to go and take that next step in their journey, what words might you share with them?
Good question. And you're right. And I think just hearing her speak, like I empathize and understand completely everything that she is saying, because that's my story too, you know? And I think for somebody that is scared or felt like they're not being heard, I mean, honestly, the only thing that I can say is just don't stop. Like, don't stop talking, don't stop, or don't let somebody else's views like interrupt with what you feel, who you are and how you feel, because like your story, your truth needs to be heard. Like, don't stop, I guess. You know, don't let, you know, you go to one doctor, don't let somebody tell you or make you feel that what you're going through is made up, or that, I don't know, like just don't stop advocating for yourself. You know your body better than anybody else. You know how things feel, you know how you react to certain things. So just believe yourself, and eventually you'll be heard. Like, and that's why it's so important that we have to share our stories. And you know, I believe social media has been a catalyst in that way. Being able to connect with others that may not go through the same thing that you're going through, but you're able to see yourself in them. You know, don't give up, don't stop, just continue to tell your truth, and somebody will hear you.
I completely agree with that point. I think, yeah, just carry on with seeking healthcare. And I think one thing that I always, because I've noticed a lot in consultations, that patients will say like, oh, you know, I didn't want to bother you, or I didn't want to do this, or I didn't want to be a burden. But I always say like, no, you have a right to seek healthcare. You have a right to be here. Like, don't feel bad for coming in. Thank you for coming in. I always thank my patients for like actually seeking healthcare. It's not an easy thing to do at all. I remember I had one appointment as a student in the GP surgery with someone who had sort of a similar story to mine of sort of dismissal with pelvic pain. And I remember just thinking the whole time, wanting to be like, girl, I feel you, like this is me. But I remained professional, waiting until she finished talking and been like, I will refer you. Like, first of all, don't worry about it. I believe you. I will refer you. So I think it's just about continuing. But I think also it's hard because, as a lot of us know, just carrying on sometimes is 5, 6, 7 years diagnosis. So I think it's also really important to empower yourself with knowledge, keeping symptom diaries, thinking about how those relate to things that you do in your day, exercise, food, what other symptoms you're having, knowing a bit about what options are available to you, knowing a bit about what categories are needed for you to be referred, and all this information is online, like to UK people, looking at NICE guidelines, that sort of thing. It's quite clearly broken down when someone needs to refer you, and it's especially really clear for period pains. I think just being knowledgeable, and always taking someone with you as well if you can. Like, it's not an easy process, so having a support network is so important. Like, even though, like I said, like, I knew the system and I knew that I was eligible for a referral and knew how to summarize my own history, I still needed my friend with me to go to my appointments, just for that moral support. It does really help in saying things, and having someone who also knows your story and has seen you go through it, who can chime in and be like, actually, no, you're belittling your symptoms. She was going through it. So it's really helpful to have a good support network.
I think you both are exactly right. As women, we're often socialized to feel like we're a burden when we take up the space, but to this process of learning that, I deserve that space, I own that space, I feel confident in that space. And it's just very inspiring and empowering to listen to how both of you have taken something that the world tried to take away from you and tried to make you bad about it, but instead find a source of strength in it. And now have you both share this strength with others to continue to inspire them. So it's really wonderful.
We have a question from the audience that I would like to ask you. So Ketaki asks, I hope I pronounce it correctly, what do you think healthcare professionals could have done differently through your experiences to ensure that you didn't feel stigmatized? Gaylyn, do you want to start?
That's a good question.
I read.
I mean, just, knowing the facts, knowing the facts, maybe for my experience in, having to have an ostomy and having my medical providers, even be hesitant in me having the surgery. Just medical providers staying in touch with, or maybe having patients connect with other patients to, get the real world experience, to get the lived patient experience, and not go on, possibly what you may have heard or how you feel. I think education is key. I always say an empowered patient is an educated patient, but just knowing, just really, I don't know, I think just, being connected with patients, I think is key. And I think we're seeing that now, how patients are being, or patient-centered care is kind of like the idea of care, the idealist care, I guess, so to say. And just being able to understand the patient's lived experience, I think is key and could be helpful, moving forward for medical professionals. I've spoken to my physicians about, I'm here for any patients that may need somebody to talk to really understand the condition. And I'm not saying that medical providers don't understand, but they don't have the lived experience that other patients have. And I think that's key for patients to be able to speak to somebody that, you know, has going through the same thing or going through similar experience. So maybe medical providers connecting with patients, you know, or connecting patients to patients could be helpful.
Yeah, I completely agree. I think sort of as a medical professional myself, I can see the sort of transition that a lot of my colleagues have gone through from, especially the medical school that I went to. It's very patient focused. Like we're taught in every consultation, you should ask a patient their ideas, concerns, and expectations. And I can see already in so many colleagues that the pressure, not that it's an excuse at all, but the pressure of the work takes away from just being empathetic and considerate towards patients. So I think it's really important to just keep that throughout your career, just keep listening, keep being open-minded, and keep being empathetic. And to avoid, I think in my experience, I had a lot of instances where I just felt a bit fobbed off. They weren't sort of seeing the bigger picture or seeing the long term. Like my first presenting complaint was 8 weeks of bleeding, which is obviously not normal. And I was told it's a breakthrough bleed. So obviously not a breakthrough bleed. That's not normal to bleed for 8 weeks. I was then told, okay, we'll just give you some tranexamic acid to stop bleeding. That's not gonna fix the root of the problem. I think just seeing the bigger picture and taking away, you've sort of clocked onto one symptom and you think it's this, so it's that. No, just take a step back and think about the fact that this patient has been going through this for however long, and maybe it's not the one single thing that you think it is. Just think about the wider picture and other things that it could be, and just listen.
Thank you so much for your words. Devon, do you want to ask the final questions before wrapping it up?
Absolutely. So to close out today and the wonderful stories and all the insight you've shared, we want to end with the question: what would a stigma-free future look like?
Obviously that would be ideal, you know. Through my advocacy, you know, I hope that we begin a dialogue and help to shift the way we see, and this is for the ostomy community, begin a dialogue of how we see and how we accept beauty. You know, I hope that, you know, other patients, other people feel empowered. I think having a stigma-free future would empower patients to more own their story, tell their story, and know that they're not alone. And really use their experiences. You know, I feel that as a person living with a chronic illness, I try not to look at it as something that has been done to me, but use my experiences and how I have survived or thrived through my illness, and use that to empower me and use that strength to empower others. So I think for me, a stigma-free world would be a healthier world where patient health outcomes are improved, quality of life increases. This applies to all different medical conditions. So I think a stigma-free world would be a healthier world, a healthier, happier, and more empowered world, so to say. So.
If only, right? Yeah, completely the same. I think that a stigma-free world would look like people being able to talk about whatever to whoever. Like, people should feel comfortable asking their friends, like, oh, are your periods also excruciating? Or asking their mum or their auntie or their dad, or it doesn't have to be someone else who has periods, especially as I was mentioning in ethnic minority communities, being able to voice that I feel like that will then lead to people feeling more comfortable accessing healthcare, talking about what they've experienced, and actually attending appointments with the feeling that they're going to be heard. I think it's you can always tell when a patient is comes to an appointment with an agenda, which is not a bad thing, but you can always sort of tell by the body language, and they're already coming in feeling like they're not going to be heard. So I think, and that can work for some people in terms of like making sure that they've said everything, but I think as well for some people it's the complete opposite, where things just go out of their head and it becomes a bit of a clash with the doctor. But I think being able to attend the appointment knowing that you'll be heard, so then feeling less anxious, more relaxed, and just being able to talk, I think that will also come from the other side, the medical field, educating doctors in the right way, and putting the work in, not just in medical school, but as you go through your career, because there's a whole workforce of doctors already out there that haven't had equality, diversity and inclusion training, and haven't been trained in the era where the relationship between a doctor and patient is collaborative. It's not the doctor says, the patient does, or if you have an idea of what something is that people are not listening to. So I think it will look like just people feeling comfortable to share their experiences, being heard, getting the right treatment, being referred to the right places, not having to be misdiagnosed and bounced back and feeling just unhappy with their medical care, and worse than that, having poor outcomes from not being heard and from the stigma.
I love that. I think, that's a future we're all fighting for, redefining beauty and having, questioning, reflecting on what we think is beautiful, and realizing our bodies were born beautiful as they are, and as they work and as they function and as they change. And also, rethinking the relationships that we have going forward with those in our inner circles and those beyond. And we're very grateful for all the work you do. So thank you. I will pass it over to Alessia to close up today.
So I just wanted to say thank you so much to Tihesia and to Gaylyn for having joined us during this event. We are so glad that you were able to share your stories with us. And if we don't have any more questions from the audience, I would close this event. I will remind you to go follow these two amazing advocates on social media. Gaylyn is Catalyst and Glamorous, and Tihesia is She Talks on Instagram, and you should totally go follow them. And after that, I can say that this event is finished. So thank you so much for joining us, and I will pass it on to the workshop team.
Awesome. Thank you so much. So I will pass it over to Alex. So now we have a workshop on patient advocacy. So if this conversation got you thinking about, how can you advocate for yourself better, or those in your community better, or your loved ones, we have practical tips and tricks that our team has put together based on what we learned in our own health experiences. So I'm really excited to lead you into that next event now.
Thanks, Tori. I'll just share my screen now.
Thank you.
All right. Hi, everyone. Thank you for joining us today. My name is Alex, and my pronouns are she, her, and I'm from Montreal, Canada. I'm here representing Medical Herstory as the Patient Advocacy Workshops Chair, and I work with many volunteers to develop workshops on patient advocacy, and I'm very excited to share the workshop with you today. So today I'm joined by a group of lovely volunteers who are going to present this workshop to you, and I'll let them introduce themselves, starting with Marta.
Hi, everyone. My name is Marta. I'm a new volunteer with Medical Herstory and the Patient Advocacy Workshop team. My pronouns are she, her, and I'm excited to speak with all of you today. Barbara, if she's here.
Hi, my name is Barbara. I'm also a new volunteer with Medical Herstory. I'm doing my PhD at the University of Edinburgh, looking at abortion, birth control, and reproductive rights in early 20th century Scotland. Pass on to Georgia.
Hi, I'm Georgia. I'm from Vancouver. My pronouns are she, her, and I've been with Medical Herstory since January. I just finished my master's degree in gender studies, and I'm currently living in Vienna. So I'll pass it back to Alex to get started.
All right, thank you. To begin, I want to give you all a big thank you for joining us today, and we hope you take away some important messages from our workshop. Okay, so who is this workshop for? This workshop is for anybody who wants to learn to become a better or more confident patient advocate. These tools are meant to empower you, but can also be used to help advocate for others in your life, like family members or friends. For those of you that will be working in the healthcare field in your future careers, these tips can also help you to better empathize with your patients. The healthcare system can be an inherently violent institution for many marginalized or otherwise vulnerable individuals. We seek to highlight how the onus of care often falls on the patients themselves and to provide some support for self-advocacy. This space is meant to be respectful and open, so please be respectful of others and remember that what is shared here should not leave the space. Please try to use inclusive language and respect what others say. We ask that you engage with the content and participate at times, but check in with yourself. If you need, please feel free to take a break from the content, stretch, and get some water. Questions are welcome either during or after, but if during, please feel free to use the raise hand function or write the question in the chat if you feel like you might forget it, and we can address it after. If you would prefer not to speak, I encourage you to grab a pen and paper to make notes or reflections throughout the workshop. Okay. Setting goals. The first half of the workshop will seek to give a little bit of language and background to discuss why patient advocacy is necessary in the first place. And the second half will focus on how to fight against barriers to proper care. And we'll be providing some tools to self-advocate as well as going over a case study. Our workshop is focused on self-advocacy, and our goal with this workshop is to provide the tools and language to empower individuals as they navigate health, wellness, and medical care. These tools are meant to give you the confidence to help advocate for yourself and others. Now I'll pass it over to Marta, who will begin with an introduction to patient advocacy.
Okay, so I'm going to be talking and introducing patient advocacy to you all. So next slide is good. So you'll find a few definitions for patient advocacy, particularly depending on the context and the perspective, but here's what we have come up with for the purpose of our workshop. The practice of advocating for oneself as someone receiving care, or the role adopted by nurses, social workers, healthcare providers, or other external bodies to guide patients throughout their care-seeking process and empower them to fully understand their rights and options. Patient advocacy can even be seen as a specialization within healthcare. So some background on patient advocacy. So we think it's important to understand the history of patient advocacy. The patient advocacy movement can be traced back to the early 1900s with organizations like the American Society for Control of Cancer, which advocated for increased research facilities and attention to the issue. However, the movement really gained traction in the 1960s and 70s, and it found its roots in the actions of two Black activists, Johnny Tillman, the founder of a grassroots mothers organization, and George Wiley, a chemist and civil rights leader who hoped to amplify welfare rights advocacy efforts. The patient rights movement of the 1970s looked to reassert the importance of accountability to patients and draw attention to the assumption that healthcare professionals and providers always act in the best interests of their patients. We know now, and we've talked today about how that is not necessarily true. This movement also overlapped with the early women's movement, which focused on increasing the standards of care for femme-identifying people, and particularly on reproductive rights. So ultimately, the practice of patient advocacy has continued to evolve along with the practice of medicine and the changing needs of our patients. So moving on to why we need patient advocacy. In the modern context, patient advocacy is important as we work towards improving a system that wasn't necessarily designed for patient control. Gender biases and gender myths are still prevalent in the medical field, and this affects the access and the quality of the care for women and people of marginalized genders. And this is compounded by things like racism, classism, and ableism. This can lead to marginalized groups experiencing a lack of diagnosis, misdiagnosis, or chronic conditions being unrecognized. Patient advocacy is important to attempt to combat some of these biases and ensure that you're able to get the high quality of care that you deserve. I'd like you guys to participate in this question, so you can raise your hand if you have ever experienced a barrier to care. So I'll be raising my hand for that, and I'm sure many of you can also attest to that, yes. So moving on to some questions about patient advocacy. So now that we have a bit more context on the reasons that we need patient advocacy, I'd like to take a moment to reflect a bit on societal stereotypes that we might encounter in the healthcare system. So although it's always good to be kind and respectful, you can change the slide. Although it's always good to be kind and respectful, our perceptions of what a good patient is often rooted in submission. So a patient who takes direction and doesn't question their physician, while defining a good doctor often has to do with the power and knowledge that they hold in society, like advanced degrees or long consultation wait lists. It's important to realize that these descriptions can be subjective and to focus on what we would like to have in our healthcare experience. I'd like to give you all a moment to consider what a good or bad patient or doctor might mean to you. You guys can put it in the chat if you'd like. So what is a bad or a good patient? What is a bad or a good doctor? Yeah, I'd love to hear from you guys. So next slide. So what type of patient are you? So there is no one perfect way to advocate, but it can be useful to reflect on your own personal tendencies and consider if you wish to challenge some of these. So some questions you might want to ask yourself are listed here. I see Ellen has responded saying that a bad doctor is one who dismisses my concerns or talks down to me. Totally agree. Good patient, come forward with respect, but stand up for yourself. Perfect, great examples. So how have your past experiences influenced how you are as a patient in medical encounters? So some of these questions can help guide your reflection. So next we'll be contextualizing patient advocacy. So how patient advocacy works in the context of care. So how can who you are impact the care that you receive? Healthcare is an institution, and like any other institution in our society, our socioeconomic standing has an impact on our experience navigating this institution. This is why it's important to consider social identities when in a medical context. Self-awareness when seeking care requires an acknowledgement of the social roles and power dynamics at play. Patients and doctors hold their own distinct social roles, and this relationship can manifest in a power dynamic, particularly because so many societies place such a high social value on doctors. By acknowledging the social, cultural, and socioeconomic pressures that apply to our own care and to the system, one can better understand how to work towards advocating for equity in their care. Now we'll be contextualizing medical privilege. So what is medical privilege? Medical privilege is the chance to experience medical help without bias, without discrimination, and without other barriers that we'll mention here. So on this slide, you will see a diagram which will help you to consider your own possible sources or the lack of medical privilege. You can try to identify your medical privilege or lack thereof by answering some of these yes or no questions. This isn't a comprehensive diagram. It's primarily just to give people an idea of some factors that can influence their interactions with the healthcare system. Everyone faces unique challenges, and this is in no way meant to diminish anyone's struggles in accessing quality medical services. However, it does help to highlight some of the structural and interpersonal barriers that might arise in healthcare contexts. Going over this diagram, we can identify the possibility for intersectionality of various disadvantages a patient might face in a healthcare setting. So next we'll be talking about how oppression and stereotypes play a role into patient anxieties and pressures. So discrimination can be on the basis of many personal factors such as gender, sexual orientation, ethnicity, appearance, physical ability, and many things beyond. There are some questions on the screen to help you reflect on whether you have ever experienced oppression due to your identity. The social stigma around certain conditions can lead to discomfort seeking medical help. Sexual health-related procedures and inquiries can carry stigma, as we've discussed during the conference, making them more difficult for folks to access sexual health services or sexual health information. Another potential source of anxiety that some people report is based on their weight. Fat phobia in healthcare setting can have huge repercussions. Discrimination and negligence based on unfair assumptions surrounding weight has exacerbated rates of diabetes, heart disease, eating disorders, and other health conditions due to people not getting the care and attention they need from the medical world. At times, the institutions where we seek health advice can make us feel crazy or annoying by diminishing our experiences. And this is just the tip of the iceberg. While some of the issues mentioned so far require deep structural changes from within the medical community and our contemporary healthcare systems, we hope to provide you with some ideas on how to better advocate for yourself within the flawed system. Now, I will pass it on to Barbara.
Yeah, so Marta addressed some patient anxieties and stresses, and one of those is sometimes being annoying when we face resistance from our healthcare providers. Sometimes we worry about taking a stand or asking extra questions simply out of fear of stepping on some toes, and that's really unfair to ourselves because obviously we should all have that confidence to stand up for ourselves to get the care that we deserve. But one really key thing to consider when advocating for yourself is disclosure, so the act of confiding information to your healthcare professional. Next slide, please. So thinking back to our definitions of a good patient and a good doctor, a good patient may be one that discloses all medically relevant information to their care provider, and a good doctor might be one that creates a comfortable atmosphere and actively listens to their patients' concerns and symptoms. But in reality, disclosure is a lot more complicated than that. Disclosure is a bit of a tricky topic because, like assertiveness, either extreme can have negative consequences. So like being too assertive can be interpreted as rude, and not being assertive enough can lead to your concerns not being heard. It's kind of the same thing with disclosures. So embarrassment can hold people back from sharing important pieces of information that may help inform a diagnosis. But on the other hand, oversharing may confuse doctors or lead to sensitive information being shared that the patient is not really comfortable with other people knowing. And for some discriminated groups, such as trans or queer people, the sharing of certain information can even lead to outing or impaired care. So being a good self-advocate really requires fully considering your own specific case and your own preferences about really everything, from the information that you're willing to share to whether or not you consent to a physical exam. So that requires some personal reflection. So one of the major lessons to take away from talking about disclosure, and that's kind of going to be a common thread throughout this presentation, is that preparation before medical appointments is really key. So now we'll look at a case study to demonstrate how this all plays out in real life. And that will be followed by some action-oriented tips and tricks. So I'll pass it on to Georgia.
Thanks, Barbara. So I'm just going to pop the case study in the chat, and you're all welcome to click on it and read along. I'm going to be sharing some excerpts from it. So the case study that we've chosen to discuss today is called fear programming. Danielle, a non-binary person who has polycystic ovarian disorder, among a multitude of other reproductive disorders, shares their experience in this story. They have their symptoms continuously dismissed by care providers and experience shame and stigmatization from their family about having to go on birth control as a method of pain management. The medical gaslighting and stigmatization that Danielle experiences negatively impacts their health. Danielle explains the meaning of fear programming, and I will share an excerpt from their story here. Fear programming is the idea that people with reproductive illnesses are lying, that it is all psychological, that some periods are just unfortunately debilitating. Fear programming is me going to the hospital 5 times for what came to be a life-threatening ectopic pregnancy, being told the only reason I was in the ER was for pain medication and that I'm an opiate addict. Fear programming is being on my deathbed, having my father and significant other at the time step out of the room while I sign paperwork stating that I may likely die as a result of the other emergency rooms neglecting me. So from this excerpt, we can hear the need for patient advocacy from Danielle's story. They struggled time and time again to find doctors who would believe their pain until their life was in danger and it was nearly too late. The neglect from doctors led to severe consequences. However, Danielle persevered and pushed for the right to care. Danielle writes that they had to do their own research for appointments, fiercely advocating for themselves when no one else would. They continued even after being shut down by more than 5 doctors telling them that there was nothing wrong with them. This shows the importance of putting your own care first and pushing for what you know is happening in your own body. Who you are, as we have discussed, can impact the care you receive. Identifying as femme, non-binary, or trans can result in relatively less medical privilege, as Marta just discussed. As a non-binary person, Danielle felt as though their identity was being robbed, and here I share a quote from them. Being queer, non-binary, and having reproductive illnesses is like having that intruder say to you, but you know you're a girl, right? What can you do when even your identity is being robbed? Alex, can you just go to the next slide? Thanks. So, some tips that could come out of this case, out of these excerpts, are preparing for an appointment, taking detailed notes of symptoms and their frequency, records of testing or records of refusal. But maybe you guys can write in the chat or put up your hand if you have any other tips that you would suggest to Danielle facing these issues and these struggles and challenges. Another excerpt, you guys can feel free to put up your hands or chat as I talk. Another excerpt from Danielle's story is, something my mother used to say to me often was, if you're not bleeding, burning, or on fire, suck it up. I was all of those things at once when the gynecologist performed a transvaginal ultrasound, telling me that I have polycystic ovarian disorder and that the only way to treat it is through birth control, pain management. That if I bleed through a pad in under an hour to go to the hospital. All at once, everything fell apart. To my father, being on birth control meant that I was sexually active. The stigma, misinformation, and lack of information on women's reproductive disorders almost entirely prevented me from getting proper treatment. So in this quote, we want to highlight that we can hear the impact of misinformation. From both of Danielle's parents, the patient is hearing judgment and stigmatization related to their illness. Pain is so often dismissed if there are no physical signs, and this specifically affects reproductive disorders, as up until recently, some disorders were only able to be diagnosed after complete removal of the reproductive organs. This means that care providers must listen to the client's needs and self-reporting of symptoms, which, as we know, doesn't always happen. There's a lack of information on reproductive disorders, especially for people who have vaginas and uteruses. This misinformation, for example, used here that birth control is only used for people who are sexually active to avoid pregnancies, is weaponized against Danielle. The lack of understanding can lead to feelings of shame and a need for hiding symptoms, appointments, and treatments. So I'll just link in the chat. Yeah, a lot of writing down questions, bring someone else to the appointments, have a support team, make a symptom diary. Yes. So the tips that we had written down were all of those as well. Choosing a care provider if that's possible, finding a support group, whether that's a friend to come to appointments or online communities, asking for specialist referrals, and making clear goals for the appointments, discussing diagnoses or risk factors. So the last little quote that I'll share from Danielle's story is, fear programming is being too traumatized and exhausted by constantly having to self-advocate, that it is almost easier to not go to the hospital than have to deal with how people in the medical field treat people with reproductive illnesses specifically. So we can really hear the resolution in Danielle's writing here. They had to persevere in the face of fear programming and advocate for themselves continuously. We can see here how patient advocacy is really difficult, and it's not something that's to be taken lightly. Each person deserves to receive the care that they need without bias or stigmatization. So we really want to highlight taking time for self-care, reflecting on your care experiences, and avoiding blaming yourself. So now we want to open up the discussion to you guys. So just, if you want, put up your hand or use the chat box. And we just kind of want to discuss Danielle's case. Any comments or questions about the story, how it made you feel, what stood out to you, and kind of what elements of the patient advocacy journey did you notice? Paulina.
Okay, can you hear me?
Mm-hmm.
Wonderful. Okay, so since I've been in patient support groups for a while now as well, unfortunately, this story, what came to mind first, that it was not very surprising. I feel like from what we share among each other with chronic illnesses, especially, or illnesses that mainly affect women, I feel like it becomes very normal to hear again and again from different people all over the world how their concerns are being dismissed by the doctor when later finding out that there was actually a disease, potentially a progressive disease that needed to be treated or needs to be continually treated. And I feel it's very frustrating to hear these stories again and again.
Yeah, definitely. It is frustrating. And I feel like we all have had a similar experience or know somebody that's had a similar experience of having the symptoms ignored or shut down, not being believed completely. Okay, if anyone else wants to share anything, you can. Marta, thank you. It made me sad to hear that they were scared to seek help. Yeah, I feel like, especially as a non-binary person, and also with reproductive disorders, the shame and stigmatization can really stop a lot of people from seeking help that they need, which is really difficult. So maybe I'll go to the next slide, but you can still contribute, definitely. To summarize what we've learned from the case study, each challenge is related to actionable steps that the patient may choose to take. So Danielle experienced shame and stigmatization of being on birth control. Something that they may choose to do is network, share information, use disclosure, but to trusted friends, family, or providers, as Barbara mentioned, disclosure is a little bit complicated. Danielle had dismissal of pain, but persevered to get care needed. So this can be, as somebody in the chat said, Paulina and Ellen, making a symptom diary, making sure you keep track of everything, the intensity and frequency of the symptoms to make sure you convey the seriousness of the issue effectively, creating a set of goals or expectations for the appointment. And some tips for facing resistance from healthcare providers is ensuring to have the appropriate documentation ready, your vaccination history, for example, or previous test results, getting refusals documented, the reasons for them, for the refusals, developing a strategy to address multiple concerns, and ensuring that you have the amount of time you need to complete the discussion, not feeling rushed. which is quite common in doctor's appointments, unfortunately, and to bring a friend. Paulina, the added dysphoria in this situation must be horrible. Yes, if you read the entire story, it's quite upsetting. And yeah, now I will pass it to Alex, who's going to go into more detail on tips and tricks for patient advocacy.
Thanks, Georgia. So now that we've learned how our identities can shape our illness experiences, and we were able to have an amazing discussion based on the case study, we can move on to the last section of the workshop, where we'll be discussing more tangible tools, tips, and resources to aid in navigating health and wellness journeys. In this section, we will give a lot of tangible tips, and we suggest that it might be helpful to grab a pen and paper to write things down as they come up. We also love your input, so please feel free to share any experiences or tips that you have pertaining to these topics that we're discussing as well. So we're going to start off by discussing the patient-physician relationship and give you tips on how to find one that is best for you. Okay. So the patient-physician relationship shapes your experience in receiving medical care. Therefore, choosing a physician that suits your personality and needs is very important. This sometimes takes positive and negative experiences to realize what you need from a physician, so it's important to reflect on your appointments once you've finished. For example, I've had doctors who have rushed through appointments, undermined my concerns, and left me confused on the next steps to take. Sometimes this would even drive me away from booking further appointments. It wasn't until I had a great doctor that would let me know I did the right thing by coming in, validate my concerns, and give me clear answers that I realized my healthcare experience could be better. To aid in the process of finding a physician who is right for you, we have put together some tips on how to select a doctor. Firstly, look up online reviews. So this can be a really helpful place to start, as people will write really good reviews that give you a better sense of what kind of doctor they are. Second is ask for referrals from previous care providers, friends, and family. Hearing about positive experiences from people you trust is one of the best ways to ensure that you'll have a positive experience yourself. And lastly, make a list of questions to ask your doctor to discern their attitudes. For example, these include how do they approach physician-patient relationships? How far in advance will you have to schedule appointments? How does their office handle emergencies? And do they have any experience working with a specific condition or population relevant to you? We also acknowledge that there are limitations to finding the right physician due to lack of availability. Especially in rural communities, there is a shortage of family doctors willing to take on new patients, and this can make finding the right physician even more difficult. So in these cases, finding the right physician may be out of your control. However, you can still be your best self-advocate. And in the next few sections, we will go over ways to help you do this as well. Okay. So now, once you've booked the appointment with a physician, we can move on to the next step, which is prepping for your appointments. So some things we recommend include taking notes of your symptoms as well as their intensity and frequency to make sure you convey the seriousness of your issue effectively. Second is to create a set of goals or expectations for the appointment. This could be such as I want to leave with a prescription for a certain condition, or you want a referral to a specialist. Thirdly, ensure that you have the appropriate documentation ready. So this can include vaccination history or previous test results. Oftentimes, you only get to discuss one topic per appointment. So talk with your doctor about developing a strategy to address multiple concerns as well. Ensure that you have the amount of time you need to complete the discussion. This may require specifically booking extra time for your appointment when scheduling it, as some doctors only allot 15 minutes per patient. So especially for those of us who don't go to the doctors often, the list of things you want to address may pile up, and it's very easy to forget some. Trust me, I've done it many times. So to avoid having to book a second appointment, try to keep these tips in mind, and remember, to-do lists are your best friends. Okay. So now once you're at the appointment, we will go over tips for talking to your doctor. So the first important thing is to bring a notebook or pen, even just your phone, to take notes of what your doctor says at the appointment. The retention rate is often pretty low, and I'm sure many of you have experienced that, where you go into the appointment, they throw a lot of information at you, and you don't remember half of what they said. So jotting down notes is always helpful for that aspect. Also, if permitted and you feel comfortable with it, bring someone with you, or if it's a telehealth appointment, asked to record it. This can help you catch the things that you might have missed. If you ask for a test or medication and they say no, ask them to document the refusal. Additionally, it's very important to ask for hard copies of test results and medical documents in case you switch physicians, because many medical facilities only keep these records for 5 to 10 years. And this is something I really didn't know before the workshop, but it can be really helpful in the future when you're looking for your medical records. Keep in mind your boundaries, emotions, and consents. Appointments can induce or reintroduce feelings of trauma, so it's okay to feel emotional or vulnerable around certain procedures. It is your prerogative to ask them to tell you what they are doing to you before they do it and why. If you feel uncomfortable with questions they ask, or you don't want to do something, especially during a physical examination, you can say no. For instance, you have the right to ask if there is a self-swabbing option as an alternative for STI testing. Okay. So now I'll address how important it is to not be afraid to ask the obvious question when at an appointment. And I know that this is something that a lot of people struggle with, including myself. We know the healthcare system has its own complicated language, which can be confusing for anyone, let alone if you have a disability which might affect your comprehension, or if the language you're receiving care in is not your primary language. There are a lot of things that may seem obvious to a doctor, but aren't necessarily to you. For example, some questions include, what exactly does a health professional mean by drugs or medication? Does family medical history include extended family, or is it just immediate? In the story, Don't Run So Fast, published on the Medical Herstory website, the writers struggle to understand what seem to be basic or obvious phrases that doctors use, and as a result, came to an incorrect conclusion. Specifically, the writer was dismissed by doctors as simply being unfit after she collapsed while running a half marathon that she had been well trained for. They asked her if she had taken any drugs that day, and she said no, thinking that they just meant recreational drugs. She had forgot to mention that she had taken her daily birth control that morning, which turned out to be the root cause of the problem. So to deal with the possibility of miscommunication, it can be useful to repeat back instructions in your own words if you are unsure if you understood them correctly. Although we may feel rushed during an appointment, our health and well-being is a priority. Having a plan and easy alternative methods to communicate with your doctor is key. You are absolutely worthy of the time and attention. Okay, so now going to one of the last slides, which is tips for reflecting on your experience. As mentioned earlier, after the appointment, it is important to reflect on how you think it went. Ask yourself questions like, do you feel like you were heard? Was the doctor welcoming to questions? Did they explain the issue in a way that you could understand? And can you see yourself sharing your issues with this person again in the future? Learning what works for you may take some trial and error, but hopefully these tips provide a good starting point. Healthcare journeys are non-linear and may take time, which can be draining on your mental and physical health. In this situation, it is key to address emotional exhaustion with seeking help, make space for more than problem solving by making time for self-care. This means giving yourself a break even if you don't feel like you've made progress. Avoid blaming yourself. It's not your fault if you're not getting the care you need. Celebrate yourself. Give yourself credit. It takes a lot to be a self-advocate. Maintain a support network. Discuss challenges with others to gain support. Medical Herstory is an example of a community of support where you can feel free to voice your healthcare experiences. There are also other Facebook groups or support groups for particular healthcare issues if you're comfortable with joining those as well. Remember that you deserve high quality care. One thing that you can all celebrate already is coming to this workshop. It takes time and commitment to show up for an advocacy workshop and suggest that you are well on the way to improving your experience of self-advocacy in the field of health. So thank you all so much for attending. This wraps up all of the content we have for today. So just to summarize what we've gone over, Marta spoke about the history of patient advocacy movement and the importance of patient advocacy today as gender biases in healthcare still persist. She also helped us to contextualize our own medical privilege and saw how who we are can impact the care that we receive. We spoke about the importance of challenging authority by speaking up about uncertainties, values, and opinions. And we dove deep into the story Fear Programming and unpacked the main messages with our discussion and case study. Lastly, I shared some really tangible tips to keep in mind as you move forward in your own medical journeys. So now we have a bit more time to answer any questions that you might have. Please feel free to raise your hand and we'll unmute to ask your question if you'd rather. You can also write it down in the chat. But if not, thank you so much for coming to the conference today. We hope you learn a lot throughout the workshop, and we'll be hanging back for another 10 minutes or so if you have any questions, comments, or thoughts that you would like to share. But if not, that's all for today.
Wonderful. Thank you very much to our fantastic patient advocacy team there for sharing some really fantastic resources on how to advocate for yourself in medical experiences. I think everyone needs to know these resources. I know that all the tips and tricks I learned from this workshop, I share with friends and family all the time. And I always offer to write up an advocacy script for someone who I know is going to an appointment soon. So really fantastic. Thank you for sharing, and thank you to all of the comments as well. Everyone seems to have really enjoyed it. And I personally have loved the conference. I think it's been a fantastic 2 days. For Paulina, who's just asked, can someone speak on how we can get involved with medical herstory? As Director of HR, I will take on that question quickly. We host recruitment cycles for volunteers twice a year. Our next recruitment cycle will actually be opening at the beginning of October, so just in a couple of weeks' time, and we'll be sure to advertise that on our social media, which is always at Medical Herstory. Every so often we do run fantastic workshops like this and wonderful events as well, so keep an eye on our social media accounts because we're always sure to advertise all of those opportunities as well.
Vidya, it's really nice to see you show up. I know we were in the workshop yesterday and we spoke a little bit about her experience. So it's really nice to see people spending their whole weekend with us, which is great.
Amazing. Well, thank you so much, everybody, for attending the conference. We have a little giveaway. So for those of you who've stuck through the whole weekend and the end, be sure to check your emails about that in the next coming days. And just again, thank you so much. It's been such a wonderful conference. It's our 3rd time doing it and getting to talk not only about the past hardships, but sort of these future goals and ideals that we're all working towards has made me feel really inspired and empowered. So I hope it has done the same for all of you as well. And yeah, I hope you all have a fantastic rest of your evening or your day. And definitely, like Ellen was saying, keep in touch with us. We've loved having you here. Awesome. Bye, everyone.